Did you know that over 60% of women after menopause report vaginal dryness and difficulty reaching orgasm? For many couples over 50, this turns into silence in the bedroom, frustration, even distance in the marriage. But here's the truth. Most men never hear with the right, medically proven fingering techniques, a woman's orgasm can not only return, it can be deeper and longer than in her 20s. Hello, I'm Dr. Rachel Myers, a board-certified OB/GYN with over 20 years of clinical experience. I've guided thousands of women through menopause hormone changes and the intimate challenges that come with life after 40. And I've seen firsthand that sexual pleasure doesn't have to fade with age. It simply requires knowledge, patience, and the right medical approach. Here's the paradox. Most men think fingering is just about sliding fingers inside. In reality, that's the fastest way to cause pain irritation or make her shut down emotionally. The real secret is rhythm precision and understanding how a woman's body changes after menopause. Once you know this, everything shifts and intimacy feels alive again. So in today's video, I'll share 5 medically backed fingering techniques designed specifically for women after 50. If you want more doctor-approved guides like this, don't forget to subscribe and tap the notification bell, and please help me reach my first 1,000 subscribers so I can continue growing this channel. And if this topic speaks to you, type 1 in the comments. If not, type 0. That way, I know how to improve and bring you what truly helps. 1. Pre-arousal stimulation, preparing the body before touch. Too many men rush straight to the genitals believing that immediate penetration or direct stimulation is the fastest way to please a woman. In reality, medical research shows the opposite. Studies reveal that more than half of postmenopausal women experience reduced natural lubrication, slower arousal response, and changes in vaginal tissue elasticity due to declining estrogen levels. This means the body after 50 needs more time, more patience, and more attentive preparation before intimate touch feels truly pleasurable. Ignoring this biological reality often leads to discomfort pain or a sense of disconnection, exactly the outcomes couples fear as they grow older together. Pre-arousal stimulation is not just a romantic idea, it is a clinically supported step in sexual health. By starting gently outside of the genital area, you are actively improving blood flow to the pelvic region. Increased circulation helps engorge the clitoral network, soften the vaginal tissue, and stimulate the release of natural lubrication. But the benefits go beyond physiology. A careful warm-up tells a woman's body and mind that this experience will be slow, attentive, and safe. For women who have spent years coping with hormonal shifts, stress, or painful intimacy, that signal of safety can be just as important as the physical touch itself. So what does this look like in practice? Begin by exploring areas often overlooked: the neck, collarbones, shoulders, inner arms, or the curve of her back. These regions contain sensory receptors that heighten anticipation without overwhelming sensitive tissue. Gentle strokes along the outer thighs, a slow caress down the hips, or lingering kisses across the chest all prepare her nervous system for deeper arousal. When you finally approach the inner thighs, do not rush. The goal is to allow her body to build a steady rise in sensation. Think of it as lighting a fire, not by striking wildly, but by letting small sparks grow into a flame that sustains itself. When your hands finally reach the vulvar area, resist the instinct to dive in. Instead, place your palm gently over her, applying light pressure and then releasing, almost like a wave rolling in and out. This movement promotes blood flow and heightens sensitivity while also creating psychological anticipation. In my practice, women often tell me that what excites them most is not a frantic touch, but the patient sense that their partner is savoring every moment. That patience translates into confidence and deeper desire. One more point is worth noting. Pre-arousal stimulation has long-term health benefits as well. Gentle but consistent blood flow to the vaginal tissues supports elasticity, reduces micro tears during penetration, and lowers the risk of recurrent urinary tract infections, which are more common after menopause. In other words, these early moments of warm-up are not only about pleasure, they are also an investment in her ongoing comfort and well-being. By the time her breathing has shifted, her pelvic muscles have relaxed and her body feels more alive. You will know that the groundwork has been laid. Only then is her body ready for more targeted forms of stimulation, where sensitivity can rise without pain or resistance. 2. Clitoral hood, stimulation awakening, sensitivity without overwhelm. Many men assume the fastest route to pleasure is direct clitoral contact, rubbing quickly or pressing hard on the most sensitive point. For women after 50, that approach often backfires. Declining estrogen can thin vulvar tissue, reduce natural lubrication, and heighten sensitivity of the clitoral glands. What once felt exciting may now feel abrasive or even painful. Clinical experience and published studies both show that premature forceful stimulation is a frequent reason intimacy becomes uncomfortable. Think of the clitoral hood as a protective veil that still transmits signals to a rich neural network beneath. When you touch the hood and surrounding folds with patience, afferent pathways engage without overwhelming the glands itself. Gentle, rhythmic contact increases local blood flow, supports tissue oxygenation, and primes the broader clitoral complex and organ system with thousands of interconnected nerve fibers extending well beyond the visible tip. The objective is not intensity. The objective is readiness. Here is a medically sound approach. After a non-genital warm-up, place a lubricated fingertip at the margin of the hood and trace small, even circles as if outlining its border. Use minimal pressure and allow the skin to glide rather than drag. A helpful guide is the face of a clock. Pause at 12, move to 3, slide to 6, then 9, and complete the loop. Maintain a steady cadence for several breaths so her nervous system can entrain to the pattern. Notice signs of welcome such as deeper breathing, pelvic tilting, and relaxed thighs. Variation adds interest without sacrificing consistency. Some women prefer 2 fingertips moving together for a broader surface, while others respond better to the precision of one. You can alternate with brief vertical strokes gliding from the mons toward the vestibule, then return to circular motion. A slow figure 8 around the hood also works, provided you continue avoiding direct pressure on the glands until she clearly wants it. If she tenses or pulls away, ease pressure, broaden contact, or step back to the outer thighs until comfort returns. The benefit is both physical and psychological. By resisting the rush to the obvious target, you communicate respect, patience, and attunement qualities that reduce anxiety and rebuild trust, especially after years of hormonal change or painful intimacy. Patients often tell me they do not want speed, they want steadiness. That steadiness lowers pelvic guarding, enhances lubrication, and prepares the body for deeper pleasure without soreness later. As warmth spreads across the vulvar tissue and the hood softens over the glands, you will feel more uniform responsiveness beneath your fingertips. That is your cue that she is ready to explore internal sensation, not abruptly, but with the same calm precision you have established here. From this foundation, we can engage the anterior vaginal wall, often called the G-spot zone, with a motion designed for comfort control and confidence. 3. G-spot engagement, unlocking the anterior vaginal wall. After her body has been warmed and the clitoral hood gently awakened, the next step is to introduce internal stimulation with care. Many men believe that penetration itself is the defining act of intimacy, but for women over 50, the situation is far more complex. Vaginal tissues undergo structural changes after menopause. The lining may become thinner, less elastic, and more prone to dryness. Because of this, sliding fingers inside without preparation can feel intrusive rather than arousing. What is required is patience and knowledge of how to reach the anterior vaginal wall, the area often referred to as the G-spot, and to stimulate it in a way that is safe, steady, and deeply pleasurable. The G-spot zone lies just 1 to 2 inches inside the vaginal entrance along the front wall closest to the bladder. It is not a single button, but rather a textured area of spongy tissue that becomes more responsive as blood flow increases. When touched correctly, it can create a unique, fuller sensation of arousal that blends pressure with depth. However, when approached roughly, it can feel uncomfortable or even trigger urinary urgency. This is why accuracy and gentleness matter so much in later decades of life. The correct method begins with communication. Before entering, pause and look into her eyes, or simply ask, "Would you like me inside?" That simple question builds trust, reduces anxiety, and confirms consent, a foundation for healthy intimacy at any age. Once she agrees, insert a well-lubricated finger, slowly allowing her muscles to relax. Stop just inside for a moment to let her body adjust. Then curl your fingertip upward in a beckoning gesture, often called the come here motion. Move slowly, maintaining a steady rhythm rather than thrusting. As the tissue swells with arousal, you may notice increased firmness or a subtle change in texture beneath your fingertip. Clinical observations show that some women respond immediately to this motion, while others require more time for the tissue to engorge fully. Watch for her signals, an arch of the back hips pressing toward you, or a sudden gasp of breath. If she tightens or winces, pause and return briefly to external touch before trying again. This adaptability shows respect for her comfort, which ultimately strengthens trust and desire. What I want you to remember is this: the G-spot technique is not a performance test. It is a gentle invitation for her body to rediscover sensitivity she may have believed was gone. And here's a quick request from me: if this kind of medically grounded guidance is valuable for you, let me know in the comments below what topic you want covered next. Your feedback helps me design content that truly serves couples navigating intimacy after 40. As she grows accustomed to this new rhythm and the G-spot zone awakens, you may find her responses becoming stronger, her breath shorter, and her movements more insistent. This is the perfect moment to begin thinking about combining external and internal stimulation, blending the best of both worlds to create a surge of pleasure she may not have felt in years. That will be our next focus. 4. Combined clitoral and vaginal stimulation. Creating a dual response. By the time external and internal arousal have been awakened separately, her body is primed for a more complete experience. This is where dual stimulation becomes so powerful. Medical research using functional MRI scans has shown that simultaneous clitoral and vaginal engagement activates a broader network of pleasure centers in the brain. For many women after menopause, this blending of sensations provides a richness they may not achieve from one type of stimulation alone. The principle is simple: create harmony between the fingertip inside and the touch outside. Insert 2 well-lubricated fingers and curl gently against the anterior wall where the G-spot zone responds. Allow those fingers to rest in a steady, beckoning rhythm. At the same time, place your thumb or another finger near the clitoral hood, moving in slow, circular patterns. The goal is not to overwhelm, but to coordinate. Think of it as a duet, where each hand plays its part in balance. One of the greatest challenges for couples over 50 is variability in sensitivity. Some women find the clitoris less responsive with age, while others find it too reactive. Similarly, the G-spot may awaken quickly for some and more slowly for others. The beauty of dual stimulation is that it allows easy adjustment. You can lighten pressure internally while maintaining steadiness externally, or the opposite depending on how she responds. Paying attention to her breathing, pelvic movements, and vocal signals will guide you better than guesswork ever could. Many of my patients describe this technique as transformative. They speak of sensations that feel fuller, deeper, and more connected, often leading to orgasms they had not believed possible in later life. For the partner, this is also rewarding. It demonstrates presence, attentiveness, and adaptability qualities that renew intimacy far more effectively than force or speed. Let me pause here to ask something of you. If you are following along and these explanations are helpful, consider sharing this video with a friend or partner who could benefit. Intimacy. Education is often hidden in silence, yet countless couples struggle with the same questions. Your share might be the encouragement someone else needs to rediscover closeness after 50. Returning to the technique, the most important factor is consistency. Once you find the rhythm that makes her hips rise or her breath shorten, stay with it. Resist the urge to switch patterns or increase force abruptly. The nervous system builds toward climax through repeated, predictable signals. If you break the pattern, you may interrupt her ascent, but if you remain steady, she can surrender fully, riding the wave of dual sensation until her body demands release. When done with care, this coordination often leads to what women describe as a whole-body orgasm, one that leaves them trembling, tearful, and profoundly reconnected to themselves. And once she has reached that state, your role is to maintain the anchor, holding her safely through the intensity. That brings us naturally to the final technique, how to sustain consistency during orgasm itself, ensuring that the release is not cut short, but carried through to its most satisfying conclusion. 5. Consistency during orgasm holding, steady through the peak. When a woman approaches climax, her body gives unmistakable signals. Breathing becomes shallow and rapid, thighs tense, and the pelvic floor begins to contract involuntarily. At that moment, many partners feel the temptation to speed up, press harder, or introduce new motions, believing more intensity will heighten the release. In truth, abrupt changes at the edge of orgasm often interrupt the neural rhythm required for completion. Instead of building to a satisfying release, she may stall, leaving both partners frustrated. This is why consistency is the final and most essential technique. The female orgasm depends on sustained stimulation that allows sensory pathways in the spinal cord and brain to synchronize. The clitoral and vaginal nerves must receive repeated signals at the same frequency long enough to trigger the cascade of muscular contractions and endorphin release that define climax. If the rhythm shifts suddenly, the nervous system resets and the momentum collapses. Remaining steady even when your instinct urges change is what transforms effort into fulfillment. How should this be applied in practice? Once you notice her body surging toward release, hips rising, voice deepening, muscles gripping, hold the pattern you are already using. If your fingers are curling inside at a gentle pace, continue. If your thumb is circling around the hood, maintain the same pressure and rhythm. To you, it may feel repetitive, but to her, it is the anchor that carries her through. Think of yourself not as the driver, but as the steady ground beneath her as the wave crashes. The effect of this steadiness is profound. Women often describe these orgasms as fuller, longer, and more satisfying than those achieved in earlier years. The combination of physical release and emotional reassurance that he stayed with me, he did not pull away, can restore confidence in intimacy that menopause or age-related changes once eroded. In my clinical practice, I have seen couples leave years of frustration behind. After learning this single discipline, resist the urge to change at the critical moment. Beyond the immediate pleasure-consistent technique, reduces the risk of post-coital soreness. By avoiding frantic or harsh motion, the tissues are allowed to contract and release naturally, minimizing microtrauma. This is especially important for women after menopause, when vaginal tissue is more delicate and slower to heal. Thus, steadiness is not only a gift of pleasure, but also an act of care for her long-term health. And before we move to the conclusion, let me invite you personally, if this knowledge has been meaningful, take a moment to write in the comments one insight you are taking away. Your reflections not only support this channel, but may encourage others who feel isolated in their struggles with intimacy. When the climax has passed and her body softens into relaxation, your role changes once again. What follows is aftercare, the gentle attention that makes her feel safe, cherished and valued long after the trembling subsides. That final step ensures intimacy is not just about orgasm, but about lasting connection, and it will be the closing message of this guide. Translating these techniques into everyday intimacy requires small, intentional steps. One of the most effective habits is learning to slow down before every encounter. For men, this may mean reframing intimacy not as a goal-oriented act, but as a process of gradual awakening. Begin with affectionate touch outside the bedroom, holding hands, stroking her back, or lingering kisses. These gestures create emotional readiness that carries into physical arousal later. For women, open communication is equally important. Saying what feels good, what feels too much, or when you need a pause can be difficult, especially after years of silence. Yet couples who practice brief, honest feedback find that arousal becomes less stressful and more collaborative. Using a simple phrase such as, "stay just like that," or softer, please provides guidance without breaking connection. Another helpful adjustment is the use of water-based lubricants. Declining estrogen naturally reduces vaginal moisture, which can make penetration or manual stimulation uncomfortable. Lubricants not only decrease friction, but also support tissue health by reducing micro-irritations. Choosing unscented, pH-balanced products ensures safety for delicate postmenopausal tissue. Men should also observe recovery patterns. Some women may feel sensitive for several minutes after orgasm. Shifting to gentle caresses or holding her closely reinforces trust and makes her feel cared for, rather than pressured into repeating the cycle too quickly. The most important point is to approach intimacy as a shared practice. Each small change, slower touch, consistent rhythm, open dialogue builds confidence over time. Couples who apply these habits consistently often rediscover not only physical pleasure, but also a sense of partnership that feels renewed and sustaining well beyond the bedroom. As we close, let's bring the lessons together. Female intimacy after 50 is not lost. It is transformed. Hormonal changes do slow arousal, reduce lubrication, and alter sensitivity, but these shifts do not erase the capacity for profound pleasure. With the right approach, women can still experience orgasms that are long, full, and deeply satisfying. The 5 techniques: pre-arousal stimulation, clitoral hood touch, G-spot engagement, dual stimulation, and consistency during climax are not tricks, but medical strategies grounded in physiology and respectful connection. What matters most is patience. Rushing increases pain, while steadiness fosters trust. A warm-up primes circulation. Subtle clitoral touch awakens sensitivity. Careful G-spot motion deepens arousal. Dual stimulation expands the experience, and consistency ensures a complete release. Each step honors how the body changes with age and provides solutions instead of frustration. My advice to couples is simple. View intimacy as an ongoing conversation. Let touch and dialogue work together without shame or urgency. Men should remember that repetition is not failure. It is the very rhythm her nervous system requires. Women should remember that their needs remain valid and worth voicing. With practice, partners can reclaim closeness once thought impossible. Thank you for staying with me through this guide. Your time here tells me you value evidence-based solutions over myths and quick fixes. If you found this helpful, please like the video, subscribe, and share it with someone who may benefit. And most of all, never forget, pleasure does not disappear with age. With knowledge, patience, and care, it can grow richer than ever before.